Hello everyone, my name is Danielle Beecher. I'm from Cedar Crest College in the nursing program, and I'm going to be doing an individual critique presentation on Robert L. Massey's article titled Return of Bowel Sounds Indicating an End of Postoperative Ileus. Is it time to cease this long-standing nursing tradition? So to get started, POI, or postoperative ileus, is a form of GI dysmotility in that absent or delayed gastromotility causes a retention of gas and fluid within the gastrointestinal tract. It is very common in patients who undergo abdominal surgery, and it's thought to be caused by a stress response on the body due to abdominal incisions, the removal of abdominal lesions, and just overall bowel manipulation. It lasts approximately 3 to 5 days post-abdominal surgery, and it is assessed by healthcare professionals by the auscultation daily for 5 minutes in each of the 4 quadrants of the abdomen, totaling 20 minutes, and this is to identify a return of bowel sounds as an indicator of the end of POI. The problem is that prior evidence does not support the effectiveness of this traditional auscultation methodology. This is clinically significant to nursing in that this is the universal practice as an indicator for the end of POI. There are more reliable methods that could be used, and POI in general is an expense to healthcare in that it increases the duration of hospital stay. The purpose of this study was to determine if the rocking chair motion would influence the duration of POI, as well as to determine the efficacy of return of bowel sounds and the end of POI. The questions that the researcher is trying to answer is whether a rocking motion would decrease the duration of postoperative ileus following post-abdominal surgery, as well as to determine if bowel sounds and the end of POI are related, and if bowel sounds is a good indicator for the end of POI, since there is previous research that shows this is not an effective methodology. And it's also used, or the other question that they're trying to answer is whether bowel sounds and flatus are related, since there's a gap in literature in the association between bowel sounds and a specific indicator for the resolution of POI. There is no conceptual model or theoretical framework identified by the author in this study. However, he does state that it is guided by evaluation of previous evidence, such as his own as well as others. The design is a randomly assigned 2-group post-test only. It is post-test only because it is post-abdominal surgery, since POI did not occur until after the abdominal surgery. The research variables of the study are the independent variable being the rocking chair intervention, which included the rocking chair motion combined with the standard care. The dependent variable was the duration of postoperative ileus following post-abdominal surgery. And the research variables was auscultation for the return of bowel sounds, as well as the passage of the first flatus. The sample was a convenience sample. It included 66 participants that were randomly assigned to either an intervention group, which included 34 participants, or a control group, which included 32 participants from the University of Texas MD Anderson Cancer Center. The inclusion criteria for the study was that they all had to have digestive system cancer, all were scheduled to undergo abdominal surgery, had to be English speaking, had to be cognitively intact, had to be ambulatory, and had to provide self-analgesics. Exclusion criteria was not specifically stated, however, it would just be the opposite of inclusion criteria, being that they did not have digestive system cancer, were not undergoing abdominal surgery, did not speak English, were not cognitively intact, were not ambulatory, and could not provide self-analgesics via IV or epidural. The data collection procedure started by IRB approval from the University of Texas MD Anderson Cancer Center. They then were provided with informed written consent by each of the participants during the interview pre-operative, and the participants were also randomly assigned pre-operative to either the control group or the intervention group. There was a daily assessment then that occurred with each of the participants by the primary investigator. This included auscultation of each of the 4 quadrants for 5 minutes each, and they also had nurses and doctors complete medical records that were then evaluated by the primary investigator, and everything was kept on a data sheet. The results indicated that there was no significant difference in time to bowel sounds between the control group and the intervention group. There is also no significant correlation between bowel sounds and first flatus in the combined groups, as well as no significant association between bowel sounds and the resolution of POI. This is a chart that just goes to also show that the duration in time of days following post-surgery to the return of bowel sounds between the rocking group and the non-rocking group did not have much difference. So this indicates that the rocking intervention did not really decrease the duration of POI. Limitations to this study were not directly identified by the author. There were no demographic information included in the study, such as age, which could influence GI motility, since GI motility tends to decrease with age. Gender was not included. BOI or BMI index was also not included. These could have been influences to GI motility. The sample selection could also be an influence depending on location, as well as the fact that that all of the participants had some type of digestive system cancer. This could be an influence to their GI motility, since this seems to be generalizing to all patients who are undergoing abdominal surgery. There was also no model or framework identified in this, so it could be leading to an inaccuracy, or it could be a threat to the validity of the study. The implications for nursing is that this traditional practice should be used with caution, since there is no significance found between the return of bowel sounds and the end of POI. There are more reliable indicators that could be used as a resolution of POI, such as the passive of postoperative flatus, the elimination of abdominal distension, nausea, vomiting, and tolerance of diet. So to conclude, this traditional method should be used with caution. There is no correlation with the return of bowel sounds and first flatus, no significant association between bowel sounds and end of POI. There are more reliable measures that could be used for the end of POI, and the rocking motion did not decrease duration.